I want to thank all of you for being here and taking the time to get together. I have really enjoyed the fact that the people here at Huffman have been willing to get together on a regular basis and have conversations about issues that are really important to both the community and to you. As you know, my grandmother lived in this facility, and some of you were her friends, and I greatly appreciate that. The issues that we have dealt with have been on the community, on neighborhoods, on jobs, on economics, on the prescription drug plan under Medicare, and now we have the important issue of the national health care plan. And I wanted to take an opportunity to talk to you about that, but also more importantly, I wanted to take the opportunity to hear from you, because I know that you're well informed, you're watching the news, you're talking to each other, and that you have questions that are ones that I think will be important for us to hear and to take back to Washington so that we can advocate on your behalf, but also that we can hear the types of things that are important to you and are issues that are of your concern. It's been my honor to represent you for the 3rd Congressional District, and we have had very important issues and over the past 6.5 years that I have been in Congress. Those have included, of course, Iraq, Afghanistan, the economy, and how we move forward as a country. Certainly, national health care is one of the most important issues that we're going to take up because it touches everybody's life. When we think of our families, when we think of our own health care, it's an issue where we all have to be concerned when there are changes that could affect our relationships with our doctor, the type of care that we receive, and really the type of care that our families receive. So I've got a few questions to start off the discussion that I'd like to ask you because I think they will help frame for us this national health care debate. How many of you know people who do not have health care insurance? There are way too many people who do not have health care insurance. How many of you during your life have gone through times where you didn't have health insurance? That's what I thought. I thought that a lot of you might have gone through a period of time where you were worried about whether or not your health care bills could be paid. And I know when I was here and we had the discussion on the prescription drug benefit, there were people in a couple of the St. Mary's facilities that struggled every month with the issue of how to pay for food and rent and their prescription drugs. And that's a decision that we should not have our seniors making. That's why I was glad to support adding prescription drug coverage as part of your Medicare coverage. How many of you know people who have a pre-existing condition? They've either had diabetes, a heart condition, or cancer, and they're worried that if they lose their job, that they won't have coverage because of their pre-existing condition, another job, or you might know people who have that pre-existing condition who've lost their job and who are now worried as they go and look for a job that their conditions might not be covered. How many people know someone in that situation? And that's something that we need to remedy. People should not be in a situation where when they lose their job or when they're concerned about the job that they have, that they're worried about whether or not they're even insurable for the conditions that they take with them, whether it be diabetes, a heart condition, or cancer. Now, how many of you are concerned that Medicare has a projected insolvency and we're worried about whether or not there's going to be sufficient funds in Medicare to provide the coverage that you currently have? Yeah, a lot of people are very concerned. How many of you currently have Medicare Advantage? The Medicare Advantage program. Okay, I got a few of you. Here's one that I always find interesting to talk to people about. How many of you like your doctor? How many of you like the doctor that you currently have? Yeah, I can raise my hand on that one too. I like my doctor also. How many of you think that doctor-patient relationship ought to not be interfered with by the government? That the government ought not be standing in between you and your doctor? I agree with that too. Now, how many of you are concerned about what you've heard about the new national health care plan, that plan has additional bureaucry and this new end-of-life counseling program that they're putting? Does that concern you? That concerns me. It concerns me. And how many of you are concerned about the out-of-control spending in Washington that makes it more difficult for our country to move forward economically? Yeah, I am too. I am too. Well, I thought that would be a good point for us to start our discussion because there's a couple things that we agreed on. You know, one, we agreed that the current healthcare system needs to be fixed, that there are problems. There are people who do not have healthcare coverage, who need coverage. There are people who currently have jobs and pre-existing conditions who are worried about losing their job. And there are people who have lost their job or are making a transition who are worried about whether or not they're going to be able to get health insurance company coverage if they change jobs. And you all like your doctor. And I think that's important too, because that's the whole basis of what we do when we go to seek medical care, is we go to a professional who is educated, who cares about our service and whether or not, you know, how we heal and what medical services that we need. So I want to tell you a few things that I believe about the current healthcare crisis and what some of the things that we need. One, you know, there is no issue that affects us more deeply than healthcare. It goes right to each of us and our family members. We need to make certain that reliable healthcare is available to families, and these are some of the things that I think we need to change. One, I think that we should prohibit insurance companies from eliminating people based on pre-existing conditions. If you show up for a job and for health insurance, if you've had diabetes or a heart condition or cancer, you should be able to be insured. Two, I believe that we need to invest heavily in medical research. It's the ingenuity that has changed the care that we all receive. A lot of the care that we receive now, 5 years ago, would not have been of the level that it is now because of the research that we do, the ingenuity, the commitment that we have to life, and also the system that we have that permits people who have the ingenuity and the insight for research to undertake that. I believe that health insurance ought to be portable job to job. If you have a job and you have health insurance that you like and you're moving to another job, you ought to be able to take that health insurance with you. And right now our rules and regulations don't permit that. The new employer can't accept the insurance, the old employer can't let you remain part of that insurance, and the costs and the tax structure are such that people don't have the ability to take their health insurance with them. I think they should. If you have health insurance that you like, it's with it, your doctor accepts it, perhaps even you're in the middle of receiving care, you ought to be able to take that health insurance with you. I believe that small businesses ought to be able to band together in larger groups to be able to get health insurance. You know, our realtors are an excellent example. Our realtors are a member of a national association, but the national association can't pull them all together in a larger group to be able to provide health insurance, and that's something that we ought to be able to do. I think we should get rid of frivolous lawsuits. So many times we hear in the news of someone who's won an astronomical case that's almost like winning the lotto, that we all pay for. That money is not free. We need to make sure that people who have been injured get the care that they deserve and the compensation they deserve, but frivolous lawsuits need to be curtailed, and it will lower all of the costs in the system. And I believe that there should be deductibility of health insurance. You know, your employer, when you work for somebody and they provide you health insurance, they get to deduct the health insurance. I think that people ought to have the equivalent. If you have health insurance, you ought to be able to deduct that directly from your income, because we have an interest to have an incentive for people that have health insurance. And of course, as you know, we have already passed several times opportunities for health savings accounts that I have voted for, and those make a difference where people can take dollars and set them aside for their own health care on a tax-free basis, and then we can encourage them to be able to have those dollars available when they do have the need for them. Now, why am I against the National Health Care Plan? And I am against it. This National Health Care Plan calls for deficit spending of over $1 trillion. Almost every economist will tell you that the current deficits that we have on the federal government are not sustainable. And if we put a national health care plan that requires deficit spending in the area of $1 trillion, we are only making our country less stable, not more stable. The plan also calls for changes that would affect current coverage. There's over 150 billion, it's hard to not stumble over that, $150 billion that are taken out of the Medicare Advantage program. Now, we all know that the Medicare plan is currently one that has projected insolvency. We can't have a plan where we're taking money out of Medicare and believe that we're going to have it sustain itself for the future, we should be investing in Medicare, not taking money from Medicare, because we've made promises to our seniors and we need to live up to that promise for their care. And I don't think that we should ever violate the doctor-patient relationship. You all raised your hand and said you like your doctor, and I don't think that there should be a health commission that gets to decide what that relationship is or what coverage or care that you receive. That should be fully in the responsibility of your doctor, because they know. They know what you need, they know what the diagnosis is, and they know what treatment will be effective. I believe that research on the medical side, where we get our advancement that saves lives and makes a difference in our quality of life, should not be the precursor of the federal government. This plan calls for a commission that will review medical research. And I think the federal government, whenever we're involved, we restrict innovation. We don't encourage innovation. And so I think medical research should remain something that is free for people to undertake and to advance our capability to impact people's lives. And I believe that their end-of-life focus is wrong. I don't know anybody who believes that, that the promises that we've made through Medicare to our seniors should be modified in a plan that has end-of-life counseling and a look at restricting care. There are too many people who care so much about each of you that the government should not be involved in that at all. And I certainly know from when my grandmother was here that I certainly would not have wanted to look to anyone in the government to make any decisions for my grandmother as we honored her life. And now, I want to take the opportunity to hear from you, because you have been reading, you have been watching the news, you have heard a tremendous amount about this plan. I'm home here in August to be able to return back to Washington in September, and we're going to be part of the discourse in demanding answers to questions, in looking at the provisions of the bill. And if you take a look at this bill as I have, you can see that there's a number of things in here that you might have concerns about. So I wanted to open it to your questions so that I can take them with me and make certain that I continue my representation. Yes?
Well, I haven't really heard what they're covering. I haven't heard what the health bill's about.
It's an interesting issue of, well, what coverage do you get? In the bill, there's the provisions for determining what qualified coverage should be, what coverage that you should receive. There's a commission that's impaneled to make recommendations, and in that empanelment, then we get the answer to what the coverage would be. So you're absolutely right. You won't, in this discussion, hear what this plan would provide you for coverage, because they're delegating it to a group who we don't even know. So if we pass this, we will have empowered a group to sit down with a piece of paper and fashion out what the coverage is that you're to receive. And that's not something I think we should be doing. Yes, ma'am?
What about the living will? How does that compare with the end of life that you're talking?
The living will is a document that currently under state law you have an ability to define some of your wishes. The end-of-life counseling under this bill, people have concerns about it because the federal government is stepping in and saying that they're going to provide on a 5-year rotational basis professionals to sit with you and help you fashion what your plan would be. And the concern that many people have is the moment that the government starts into that process, they have an interest in what its outcome will be. Now, the president just said he wants to encourage living wills, and that certainly is a position for the president to take. But I don't believe that the government ought to be involved in that, in coming to the table with you. Currently, the living will is something that you'll sit down and you'll talk to your family about, you'll talk to your doctor, and you'll talk to other people in your community. I don't think there should be a provision where you're sitting down as part of a government process in that discussion.
Well, I have.
You have one? Okay.
Those of us that are in the Advantage plans are in them because that's all we can afford. What would we be offered instead of?
Yes. Well, and that is a big concern. The Medicare Advantage program, they're going in and taking out $150 billion out of the Medicare Advantage program. And although they're saying it wouldn't end the program, they're not completely eliminating Medicare Advantage program, they're taking monies out of the program. That can only result in reduced services. The money has to be made up somewhere else. And so I'm very concerned that it could result in increased costs to seniors or a restriction overall in the services that are provided. And that's one of my biggest concerns. Now, some of you may recall, about a year ago, we had a discussion in Congress about what's known as S-CHIP. It's a state health insurance program plan that provides for children an opportunity to get health insurance, because you know it is so important that we provide care directly to children, because it can affect their future if they have a medical event where they're uncovered and they don't get the care that they need. Initially, that plan had called for funding S-CHIP by taking money out of Medicare Advantage and moving it into that plan. And I opposed that. I voted against it because it was going to take money out of Medicare Advantage, and ultimately, when it got to the Senate, they had to refashion it because the Senate was opposed to it too. The S-CHIP program came back, they fully funded Medicare Advantage, and the S-CHIP program was funded from different sources, and I was able to vote for it then as it went back to the Senate. I am hopeful that the Senate this time will not let them do this again, because the Speaker of the House has currently gone to that pot twice. The Senate has stopped her once, and I hope they stop her again. Other questions? Yes, ma'am.
I came with a lot of comments, and you've answered a lot of them. Thank you. One of them is, why is Medicare not permitted to bargain for lower prices? Walmart, Kroger, everybody else is selling a month's supply of medicines for $4. When that prescription Medicare went in, our insurance, immediately our copays went up, and they have been rising ever since. And so it seems to me that one of the places you could save money for other care is to insist that Medicare bargains for decent medical prices. They give all this other nonsense about why it costs so much. We know very well those companies are not funding any research. They're not getting funding from the government or someone else. So that's not a true argument, and it should be disallowed. And I do believe there should be a public option for those who don't have a job now and don't have insurance and they don't have any place to carry it from. I like their idea of carrying insurance from one job to another. I have a niece that was in that situation. She lost her job because of the insurance, because the employer didn't want to pay her insurance anymore. He calls her back for jobs once in a while. But he doesn't have to pay her insurance. She has several conditions which a new company isn't going to fund. And that should not be. And then, this may sound smart aleck, but I reminded a few other politicians I've heard to recently, but we do provide health care for you, us taxpayers, and a lot of us taxpayers can't afford our own. I think that's something you ought to think about.
Very good. Well, let's start with the first one. You know, I definitely think in the issues of the uninsured and the underinsured that we need to take action. If we clean up some of the issues that currently affect the system, pre-existing condition, opportunities for people to have portability, opportunities for tax deductibility, opportunity for to ensure that people who have insurance can maintain it and keep it. We then have to look at the issue of how do we provide coverage for those who are uninsured. The S-CHIP program, which I supported, which just expanded its coverage, was one of those options to be able to look at how do we make sure that children have that coverage. We need to look at other options too. This plan that's currently on the table is not it, because we should not do that. Now, the president said, we're going to do this and everybody gets the coverage that they have. But they didn't do that. They went in and said, we're going to change the employer-employee relationship, we're going to change the doctor-patient relationship, we're going to change the senior Medicare relationship, and from that, then, we're also going to add on to an additional option, and I have concerns for that. On the prescription drug negotiations, certainly, there is a difference between can they negotiate and what they negotiate for and should. As you know, many of the prescription drug plans have direct negotiations with the providers, and that certainly is something we can and should do. And there are opportunities, just like you're describing, where we can go and get savings that are not going to result in reduced care, and that's where we need to be looking. Not here. Yes, ma'am.
This is something that's happened to me the last couple months because I had an illness this spring that I had to buy several extra medications. And when I went to my doctor and I wasn't able to pay my copay because I was buying other medications, it doubled my copay. And I wondered if that was legal.
Well, I have not heard of that, and I've got staff here. Let's see if we can help you and take a look at and how that happened to
Double
you.
my copay.
And
If my doctors are doing it, I'm sure other doctors are doing it too.
Right, because if you're having difficulty paying, penalizing you, it is going to make it easier because you're just going to have additional expenses for your care that you're going to have to apply money to. Yes, ma'am.
My big problem with the prescription drug plan is that most of my prescriptions are preferred, not generic or not brand, they're preferred. And some of them, I mean, I pay $250 a month anyway on drugs, and some of them I can't afford, so I don't. One is $160, and I can't do that.
Wow.
And as far, I have a supplementary. I don't have the Advantage. I have a supplementary plan, and that's $225 a month to pay for what Medicare doesn't pay, because the doctors that I go to are not considered. They're considered specialists. So that's $35 a whack, and I go to just taking shots twice a week, and you know that really adds up. And I couldn't take a Medicare Advantage because it was higher than what.
One thing that we probably need to do, because we had a forum here on the prescription drug plan and the plans that are being offered.
But there's so many different. Everybody to talk to, or you listen to the news. Why there's so many? You know, this.
Too many options.
This is this way, and this is this way, and they're so far apart. And it's too bad that the country can't get together and do something together that's going to take care of all of it instead of fighting about which.
Right, and what I was going to say is before we had come here with individuals who helped as advisors to take a look at the prescription drugs you currently had, the plans that were there, and give advice as to what was out there. Perhaps we could look at hosting another one of those here and look at a couple of the other facilities. Maybe we can pull people together because part of the problem is sifting through what's out there and the information to make certain that you're in the right plan that you need to be in. And that's something that perhaps we can help with.
Can I ask you a question?
Sure.
Can you explain to me what they have hammered out on Medicare? What provisions have they hammered out so far?
Well, the bill is not finished yet. What has happened at this point, and I know you all know how Congress is organized, but I'm going to start with that process first. You know, the House and the Senate, and underneath each there are committees. And on the House side, there are 3 committees that have been working and contributing overall to the discussion on health care, and there is one bill that has coalesced that everyone is working out of on the House side, but it has not passed the House. It has come out of committee. And there are a number of provisions that people are still discussing, so it's hard for anyone to wrap their hands around what is the one plan that we're all discussing for a vote up or vote down, because they're not certain what ultimately
We all know
defines
that
the House floor.
Medicare and Medicaid has to be changed. There have to be changes made. It can't sustain itself the way it is.
Absolutely.
And they've got to make some kind of changes, and I just don't see how it's going to turn out. Who's going to pay for this?
Right, well, and this is why it was so important to talk to you today, because as this bill's coming forward, and the Senate doesn't have its bill yet, the bill that's currently most prominent on the House side takes $150 billion out of Medicare Advantage and additional monies out of Medicare. And I want you to know that I oppose that I understand exactly what you've said, that Medicare is currently facing a future insolvency, and you don't take a system that is in a disadvantaged position and take money out of it and ensure that you all have quality care. And we're going to make certain as we fight this battle that the first thing is that we honor the promise that was given to you and that we honor the care that you receive. So I appreciate your comment because you're absolutely right. You had a question?
I just wondered how many people realize there are programs out there through the pharmaceutical companies that where you can get your medications free.
Yes, and we had some of them here, and it depends on what your prescriptions are.
Right, and your income.
But I do think that some of that information isn't out enough, and maybe we can
Right.
help in getting them back here. And sometimes it fits and sometimes it doesn't, but if you don't have any of the information, you don't know.
Right. I mean, I just got a $225 a month prescription for free by picking up the phone and calling.
Very good.
So, but you have to know where to start.
That's right. And maybe we can start to help with that by bringing them back here again. Because I think it was 2 years ago that we had them here. Maybe we can do that again.
That would be good.
Do you all have any other questions?
Yeah,
Not?
yeah.
Yes, sir.
We're talking about a lot of things here, but if they get what they want, that, or they come around and investigate you every 5 years if you're old, that's our death knell.
Yeah.
Let's face the facts. They said they're going to have to cut Medicare so they can get into the cost. That means rationing. As soon as they get rationing, if you come up there, 2 guys come up here, one's as old as I am, 90, and one of them is 25, and they both need knee operations, they'll tell him, well, we can't give both of you, here's a cane. It's coming, and then that just means we're going over the pond, because when it comes to giving you your drugs, they won't give them to you, and then you're going to die. So that's what you might as well say. If they get that part, if they say they took that out, but as soon as they pass the bill, they'll sneak it back into one of your other bills.
Yeah, and that's why I wanted to come and talk to you also. You know, last week, my whole family got together to celebrate my dad's upcoming 80th birthday. And I know...
He's a youngster.
He's a youngster, yes. With you being 90, he's a youngster. And I know that there are a lot of people who have the concerns that you have, which is, you know, who's going to live up to the promise to me? Because we've not just been on ensuring that people get the care that they need to extend their lives, but also quality of life. I mean, when you talk about knees and hips and those replacements, I mean, we've not made a promise to people who are Medicare that we're just going to provide them the care that keeps them alive. We've made the promise that we're going to give them the care so they can enjoy life and participate and take advantage of your grandkids and be there and do the things that we all want you to do. So you have my commitment that I'm fighting for that not to happen.
I tell you, if that guy comes out here and is going to investigate me every 5 years, he ain't going to do it.
Yeah, I think you might chase him out of here if he shows up. So I believe that. Okay, yes.
I'm really upset because, as you said, the committee is working on this. All these committees are working, but nobody knows what's really coming. And I don't want to see what happened with some of the, like back many years ago with the Vietnam War, the present war. That Congress ended up passing a law without having time to read it. But I think part of the problem that there's so much heat right now around healthcare is there's a lot of misinformation. I watched Face the Nation or one of those, and they had 3 experts who were supposed to know what was going on, and what they said is, the problem is, we don't know, nobody knows. So there's plenty of room for misinformation out there. Some of it's sowed on purpose, and you know that, and I know that. But some of it is just misinformation because people are afraid. I think there has to be a lot more transparency in the Congress, both the House and the Senate, so we know what's going on, and it's not just thrown at us at the last minute.
Well, I agree, and here's the bill. I can tell you that this is a pretty heavy reading, not just in volume, but in how it's written. And that's why I think there's some also of the misunderstanding and the misinformation that people are talking about, because, one, we don't even know that this is the bill. That's ultimately going to be the one that's on the House floor. You know, I may know this one, but I don't necessarily know what they're going to do next. And I can tell you this one is the wrong bill. And hopefully we can get it fixed when we go back to Washington. I'm going to take 2 more questions. I know you all have it in the afternoon.
This
Yes.
is not about the Medicare or anything. I'm concerned about the war situation in Iraq and Kuwait. I have a nephew who joined the National Guard. What is the purpose of the National Guard? Aren't they supposed to help the people in this country? why are they always sent over there?
Well, they do both, and I know you know that unfortunately,
He joined in order to get some money actually, because he was getting near 40 and was unable to really find a decent job. So that was back in 2005. They trained him for about 6 months and sent him over to Kuwait. And I said, you're National Guard, isn't that supposed to be to help the people in this country? What happens if something happens here? Our National Guard is over there. And he has to go back. He was over there over a year. And next April, he has to go back in for more training and be sent back over there. And it just doesn't make sense to me.
well, as you know, I serve on the Armed Services Committee, and I do that because not only we want to honor our men and women who are serving, certainly our national security is the most important issue, but also because we have Wright-Patterson Air Force Base in our community, and it's the largest single-site employer in Ohio. And I can tell you that the National Guard has had a tremendous burden placed upon it, and that's why the committee has tried to take action to support those individuals in the National Guard, but also to build up our regular Army and our regular men and women who are serving, so there isn't as much of a burden. But do me a favor, would you please tell him thank you for his service, because I don't think they get thanked enough.
Well, and the thing of it was, he enlisted just before he turned 40, which was the cutoff age, and they thought he was crazy. The recruiting officer said, "Are you out of your mind? Everybody else is going to be 20 years younger than you." But he went in, he stuck it out, and he's in with a medical unit actually. And he said there were many nights when they had bombs dropping all around him, And like he said, though, now I have to go back again next year, which is stupid,
Yeah, it's a lot of work.
And now he's, of course, what, 45, 40, and he's got a couple of children, which I said that's not good either, And but I said, if something happens here, where's our National Guard? They're all over in Kuwait or Afghanistan or somewhere over there. And every time you see anything on the TV, well, this group is going over, and they're all National Guard. What's with the regular Army? Where are they?
Yeah, very good point. Please tell him for my personal thanks and the thanks of the community.
Yeah.
I believe you had the next question.
Yes, thank you, Congressman Turner. And thank you for the help you've helped me with in the past. I'm a veteran. I was in the Marine Corps, Vietnam veteran. And your office has helped me a lot. So first, let me thank you for that. I saw what was in the paper yesterday about this, something about $500 billion. You know what I'm talking about?
Medicare. They're taking money out of Medicare for the ultimate plan.
Yeah, now, is this just a thought right now, or is this really going to happen?
I believe that the process that's happening this August, where people are letting their voices, like your voices, be known, that's not the way to provide health care coverage for the uninsured, hopefully will prevail. Hopefully the Senate will not allow it to occur, and I think that this plan is stoppable.
It will impact people here.
Absolutely, absolutely, because we need to live up to our promises to our seniors.
Because you're talking about $1 trillion for a national health care plan, and we've almost given that much back to, what do you call it, the real estate people, or the FDIC, who was it, Federal Reserve Board. They're the ones that are involved, and since they let that predatory lending happen, it's like, oh, okay, you screwed up, you killed the dog you were eating on, but we're going to go ahead and give you money. Who's going to give me my house back? Okay, I didn't get my house back, and it was predatory lending. Okay? And I called the FDIC. Anyways, the thing is that the government's giving the money to. I know they need to keep that going for the economy, even though they did wrong, predatory lending. The FDIC didn't do its job. The Federal Reserve Board didn't do its job. That, that money being given to them could have gone for better health care for the uninsured.
Absolutely, absolutely.
Who was it? President Bush. He took our national deficit from what, $3 trillion to $9? Is that what it is?
This plan will add $1.2 trillion to the national debt.
Yeah, but didn't Bush triple our national debt?
Well, it's not triple, but it was substantially increased.
Yeah, okay, so when you look at that, like I say, you can't take the promise away from people who can't go out and work, haven't got any more of those years left. It's like picking on people who can't take care of themselves.
I agree.
And that is not what I like to see in this country. It's not what I fought for. It just seems like that money that you gave to the, or not you, legislation gave to the FDIC, the Federal Reserve Board.
We could have done other things for our country with it. And instead of,
Well, we have to keep the housing industry going. I understand that. And it's a base for this country. But I don't think there was enough thought in it. And I see a lot of stuff behind the curtain that people aren't even aware of. Deals that are being made, stuff like this. And get that money somewhere. Don't take it away from people. I don't think you want to. I don't think you personally want to take it away from people. If you really need it, find it somewhere else.
that's right. That's right.
So, what's the end of life? What is that? Sorry, end of life?
In this bill, there's a provision that provides funding for end-of-life counseling on a 5-year basis. And that's part of the area where people have great concerns. The government ought to be on the end, as you were saying, with the living will in that discussion. The medical care that people receive should be based upon what their doctor believes that they should receive, both on care and condition. And that's what we need on.
Well, is there something wrong with the present system that it can't be sustained? What's the basic problem?
Well, yes. Well, the current system does have a projected insolvency, and as you're correctly saying, what we need to do is work on making certain that Medicare can be sustained, and at the same time look at how we can expand where people currently don't have insurance, and also fix the problems for people who do have insurance and who have, for example, pre-existing conditions.
Yeah, in this economical times, this is going to be this makes it.
It's a big issue. Ma'am?
Yeah.
And we'll give you the last question, and then first off, before she asks the last question, I want to let you know, we need to continue this discussion. As you know, you have seen me several times. I've been here, and I'll certainly going to be back. I'll stay for a while for other questions and comments that you have. I appreciate that you guys get in touch with my office. Also, if there's things that we can help you with, and we'll look at in the future as to how we can have a prescription drug coverage discussion here, what experts we might be able to bring to provide you assistance, and then we'll take the last question. Yes.
My EMT doctor prescribed me medicine, and they won't give it to me because they said it was too high.
And see, that shouldn't happen. Let us get some more specifics, and maybe my staff can help you in this, and we can find a solution to.
So they gave me a week's, the week's supply of the little free packets, and that was it.
That doesn't sound right. That's not what we're supposed to be doing. So let's see what we can do to help.
I asked Mom what was the biggest draw on the healthcare system right now, Medicaid, that it's not sustainable. What's the biggest draw there?
Well, there's a lot of inefficiencies in the system. There's fraud that occurs. There are a bunch of different ways that we can fix the system, and that's going to be the national discussion. With that, everybody's getting a little restless. Let me give you, before you leave, we have a flyer that we want to pass out, and I'll be staying around to have conversations with you before we leave. So we'll pass out a flyer that tells you a little bit about what we discussed today, and I look forward to seeing you again because I will be back. Thank you.